And face mask do's and don'ts. Washington County's health officer joining us live this morning with what you need to know to properly protect yourself and others. Get ready for 23 minutes of news, traffic, and weather.
You're watching KOIN News AM Extra at 7 with Jenny Hansen, Emily Burris, Ken Body, weather with Kelly Bayard, and traffic with Carly Kennelly.
And a good morning. Welcome to AM Extra on this Wednesday, April 8th. Good to be with you. I'm Emily Burris.
And I'm Jenny Hansen. We will get to some crime alerts and the latest on the COVID-19 pandemic. But first, we want to talk about what a lot of people have been waiting for, and that is some warmer weather. We are expecting to hit 70 today. There is a live look at the sun coming up over downtown Portland. It's shaping up to be a fabulous morning already.
Yeah, already pretty sunny out there. Let's check in with meteorologist Kelly Bayard. She's got Portland's most accurate forecast, looking at that warming trend. Good morning, Kelly.
Good morning. Yes, we are expecting to warm up for the first time this year into the 70s. It also lasts into Thursday, too. So a couple days here around the low 70s. We're expecting beautiful sunshine. You can see Lincoln City behind here. A little misty, but also under some calm conditions, and expecting the sun here soon. This weekend also looks great for Easter and a backyard Easter egg hunt. We'll see some nice weather for that. Possibly no rain for the next 7+ days, too. We're watching those trends. High pressure in place now. That's going to bring us some calm weather going into today. No rain expected. A lot of sunshine here and warmer temperatures, so it should be a beautiful Wednesday. Take a look towards downtown. You can see that sun starting to rise. It's a beautiful start right now. Low 40s, and moving forward, we'll stay in the low to mid 40s by lunchtime. Already close to 60 degrees. My full forecast coming up soon.
Well, right now we're going to take a look across the metro area, and you'll just see wide open highways out there. Not much traffic to deal with, so that's good if you do have to head into work. Right now, 217 at Denny looking great. Looks like there's a car northbound off to the shoulder with its flashers on, but not causing delays. I-84 at Grand, also a nice drive to reach the I-5 split. This is I-5 at SR14 coming in from Vancouver, problem-free right now, and this is 26 with a nice drive here past the zoo.
Thank you, Carly. We want to start with a crime alert this morning. All 6 suspects believed to be connected to a shooting in Portland are in custody this morning.
Police say they told people in the Richmond neighborhood to stay inside last night while they went searching for 2 people who were possibly armed. Officers set up a large perimeter from 31st to 36th Avenues from Woodward to Tibbetts. Investigators were following up on a shooting investigation from Monday. They tried to stop a car with 6 people inside, but say the car took off. Police tell us they arrested 4 of them and then the other 2 last night.
I cannot stress enough the importance that we had the community's cooperation, and they stayed inside and helped provide information throughout the evening, and this is the best case scenario.
Well, today we do expect to learn more about those suspects, including what charges they are facing.
And this morning we're working to learn how 2 people are doing after police say they were shot in a carjacking. The shooting happened yesterday near Northeast 159th and 75th in Clark County. Late last night, authorities told us the suspect accused of shooting them with an AR-15 style weapon was found dead. Deputies say his cause of death is a self-inflicted gunshot. Now to a crime alert connected to the COVID-19 pandemic. A Portland man and a Chinese company are now under investigation.
Federal agents seized 100 unauthorized coronavirus test kits that were shipped to his apartment. Elise Haas joining us live this morning with more on what we've learned from court documents. Elise.
Emily and Jenny, these COVID-19 test kits were not FDA approved, and they were prohibited from entering the country in the first place, let alone being shipped and sent to a private individual's home. According to a federal search warrant, U.S. Customs intercepted these suspicious coronavirus test kit packages in mid-March, and they realized that it was addressed to an area in North Portland. So authorities raided this man's apartment last Wednesday, and they discovered the man who bought these isn't a medical care provider, but the former owner of a now defunct cannabis business. Court documents say he bought these test kits at 50 cents each, and according to the affidavit, a coronavirus physician said 50 cents is preposterous because current COVID-19 swab tests now run at least $1,000. The Chinese company also doesn't have authority to send kits to the public. According to the feds, currently there are no approved, cleared, or emergency use authorized COVID-19 tests for home use. If these kits were marketed for the use in home, or if they were distributed as such, then the Chinese company would be in violation. So again, right now, the only way to get a COVID-19 test is from your healthcare provider. Again, there are no home use kits that are available yet. So the FBI says that if you think that you are targeted or maybe a victim of a coronavirus scheme like this, the FBI wants you to reach out to their Internet Crimes Complaint Center. Emily and Jenny.
All right, thank you, Elise. Well, Multnomah County launched a COVID-19 dashboard that's tracking the disease in near real time.
Dr. Jennifer Vines talked with us about the trends that they are seeing.
And what's really telling is that we are appropriately focused on our older age groups as being at risk, but you actually see hospitalizations across the lifespan, including people in 30s, 40s, 50s, and 60s.
Not just older adults at risk. Also, 1 in 4 people with a confirmed case of COVID-19 are hospitalized, according to the numbers we have right now. Dr. Vines added these models show that Oregon could see a peak of cases later this month or in early May.
And speaking of cases, we do want to take a look at the latest numbers. The Oregon Health Authority reports there are at least 1,100 cases and 33 deaths statewide. The Washington State Department of Health says there are more than 8,600 infections and 394 people have died. Nationwide, Johns Hopkins reports nearly 400,000 Americans are infected. Almost 13,000 have died.
Well, starting at 9 o'clock this morning, businesses can apply for interest-free loans. Prosper Portland says it awarded grants to more than 200 businesses after receiving nearly 9,000 applications. We're told those who applied for the grants can also apply for these zero-interest loans. Portland has set aside $1 million for the program. We've got a link to apply. Again, you can apply in about 2 hours here this morning. You can find that link on KOIN.com. It is 7:07 right now, and across the globe, there have been some major developments in this pandemic.
That's right. Ken Body has more on a sign of hope from China in the city where the outbreak started. Good morning, Ken.
Good morning. The city of Wuhan, China, began lifting travel restrictions overnight. At toll gates, cars lined up and they rushed out once the barricades were removed. That city was the first to see COVID-19 and was hit hard by the outbreak. Wuhan was on lockdown for nearly 11 weeks to stem the spread of the coronavirus. Chinese authorities say they will continue to monitor Wuhan's 11 million residents for signs of another outbreak. The COVID-19 pandemic still has a tight grip on the U.S., infecting people in all 50 states. And now it appears that African Americans are more susceptible to the virus. In Michigan, 14% of the population is African American, but they make up 41% of coronavirus deaths. In Illinois, they account for 15% of the population, but 42% of deaths. And in Louisiana, they have seen about 70% of the deaths in that state. The reason: African Americans historically are at higher risk for underlying health conditions like diabetes and high blood pressure.
When you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population.
The federal government is not counting coronavirus deaths by race, but the Surgeon General and the American Medical Association are now saying that should happen. The results of yesterday's Wisconsin primary will not be released until Monday, so absentee ballots can be counted. But many people were upset that that election happened at all. Voters had a tough time maintaining social distancing while trying to cast their ballots. Riley Carlson has more.
Voters faced hours-long lines in the Wisconsin primary yesterday.
I have food, I have water, I have a lawn chair, I have a mask.
But many were outraged it wasn't delayed due to the coronavirus.
I don't think people should be voting today. People dying.
Republicans blocked efforts to extend absentee voting or postpone the election.
You can call it a perfect storm, but this is by design. This is not an accident.
President Trump claims Democrats only wanted the changes after he endorsed a candidate in a statewide race.
And now they talk about, oh, safety, safety.
So many poll workers refused to work that members of the National Guard were deployed to staff polling sites.
It should have been all mail ballots in. It should have been moved in the way that 5 other states have done it.
The national death toll continues to climb, and the number of New Yorkers who have died from COVID-19 has eclipsed the number killed on 9/11.
Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother.
Governor Andrew Cuomo noted the rate of hospitalizations is slowing, suggesting social distancing is working.
We'll get through it, and over time will be normal to us.
In some areas of the country, a disproportionately high percentage of victims are African American.
It's a scar on the healthcare society that we have here in America.
Overseas, at the origin of the coronavirus outbreak, the Chinese city of Wuhan reopened after 2.5 months on lockdown. Riley Carlson, CBS News.
Grammy Award-winning musician John Prine lost his battle with COVID-19. He was hospitalized with the disease in late March and put on a ventilator on Saturday night. He died Tuesday at the age of 73. Prine survived a bout of cancer in his neck in the late 90s and lung cancer in 2013. He had a nearly 50-year-long career, playing a blend of country and folk music. His songs were covered by artists including Johnny Cash, Bonnie Raitt, and John Denver. 100 American Airlines flight attendants have tested positive for the coronavirus. That's according to their union, the Association of Professional Flight Attendants. The union says the airline has agreed to start providing face masks for frontline team members. The masks are planned to be distributed this week. American Airlines declined to comment. Amazon workers who violate social distancing guidelines could lose their jobs. The company says it will start firing those who intentionally violate the guidelines after they are given up to 2 warnings. Some workers say it's impossible to do their jobs and stay 6 feet apart, but Amazon says it has taken steps to make social distancing possible at work. And Amazon workers are, of course, working really hard these days, and there are more of them because everybody's at home and ordering everything from Amazon.
Oh, absolutely. And I would imagine those warehouses are more crowded than ever right now as they try to keep up with that demand. That's tough.
Yeah, it really is.
Yeah. All right. Thanks, Ken.
Thank you.
7:12 is the time. We've been telling you about new federal guidance that we should all now be wearing masks when out in public. But a lot of you have been asking us questions about these recommendations. Why start now? How do we make sure we're going to cover our faces well enough? Well, here this morning to break down what you need to know is Washington County Health Officer Dr. Christina Bowman. Good morning, doctor.
Good morning.
So I want to start with these latest guidelines. Why is it now important for us to be wearing some kind of cover if we're going to be out in public?
Yeah, thank you. So the CDC issued new guidance this past week asking that people, when they're out in public and can't follow the social distancing guidance to keep 6 feet away from people, that they wear a face covering. And so this is to help people if they are infected, maybe asymptomatic or mildly symptomatic, to help them from spreading the illness to other people. So face coverings are different than what we think of when we think of surgical masks. So these are cloth face coverings that we're asking people to make from things that they have at home in their house. And the purpose is to capture any droplets that might be coming out of your mouth when you're speaking, when you're maybe if you cough or if you sneeze or clear your throat.
Yeah, I think that's an important distinction to make there. That point about it's not necessarily about keeping you healthy, keeping you from getting this virus. It's about keeping other people safe. You're trying to keep anything that's coming out of your mouth in.
Absolutely. So you're trying to keep your droplets to yourself.
Right.
And I have a mask with me that's a homemade mask, and I can demonstrate, if you like, what are some good techniques for when you're wearing your mask and taking it on.
Oh yeah, please do, because I know I was running a couple errands this weekend and put a cloth covering, a bandana on, and was wondering about, like, am I taking this on and off the right way? Am I touching my face even more now and putting myself at risk? So yeah, I want your tips.
Okay, so first tip, hand hygiene. Anytime that you are touching your mask, manipulating your mask, we want you to do hand washing, or if you have hand sanitizer on hand, use that. So I'm going to do some hand sanitizer here. I store my mask in a clean plastic bag. That helps protect it when I'm taking it on and off throughout the day. And when I'm handling my mask, I want to try and handle it by the straps. so not the front of the face mask, which can become contaminated when I'm wearing it and would then contaminate my hands. So when I put it on, people have ear loops, some people are using ties. Really, the main point is to have a secure fit around your mouth and your nose. You want to avoid touching your eyes, your mouth, your nose when you're doing this. And whatever works for you. Certainly the Surgeon General, Dr. Adams, has a video on how to make a mask out of a rubber band and a t-shirt. So whatever you have on hand, if you have some sewing skills, all the better, because that might help you have a more durable mask that you can wear again and again.
Yeah, we actually showed that video yesterday too on the air. And I know the way to kind of take off and put on would probably be similar whether you have one of these sewn masks or a t-shirt. How do we take this off the right way without undoing all of our good work?
Exactly. So again, hand hygiene. And don't touch the front of your mask because you've been breathing on this and then you could contaminate your hands. So you want to take it off, the straps in the back or around your ears, not touching your face, and then put it in a bag, something to help transport it for when you take it home. And if you have a cloth mask, pick a fabric that can be washed in the washing machine, wash it at the highest temperature, dry it thoroughly in the dryer, and then reuse it.
I was just about to ask you, so if it's a sewn mask or a t-shirt or a bandana, washing that with hot water, it'll be clean if we run it through a sanitary wash?
Absolutely. So detergent, water at the highest temperature that's appropriate for the fabric that you're using, put it through the dryer at a warm temperature, and then it can be ready to be reused.
Excellent. Dr. Bowman, thank you for your time this morning. We appreciate the tips and ideas there. And of course, we've got some ideas for how to make your own mask as well on KOIN.com. All right, 7:17 is the time. We want to check in now with meteorologist Kelly Bayern. Kelly, I think a lot of people might be out getting some exercise over the next few days here. So helpful advice as we all try to go outside safely.
Yes, I know a lot of folks will want to take advantage of this beautiful weather that we are expecting this week. Today and tomorrow, potentially our warmest days of the year. So again, as we start, it's beautiful already. We're seeing blue skies out in downtown Portland, A. You can see Mount St. Helens under some blue skies. Lincoln City also turning up to show us a gorgeous start to the